In March 2020, due to a global pandemic, Ireland entered lockdown in a bid to halt the spread of the coronavirus. This video captures the community response in South Dublin from March to July 2020.
At the start of the pandemic, a number of senior managers were concerned about how our clients were going to access food and other supplies necessary. In particular, medicines was an issue. So we decided to set it up to have a free line, if we could, to get people to ring in, and if they needed help, we'd supply the help through other voluntary organisations on our own. Partnership's relation with the council, for starters, was excellent and has been over a number of years, and we've worked in partnership together on different projects. So when the forum was set up, I was asked as county champion to go onto the forum, but also as CEO of the partnership. We worked together collaboratively, and between ourselves and the volunteers, we set up a management group to actually manage the response county-wide, and I think it worked extremely well. We had approached the Department of Rural and Community Development and asked them could they allot funding to special needs in the pandemic, and they agreed, and we put a special SICAP action together to cover that. We also got funding from Google Tides Foundation to help us, which was extremely useful, and then Bank of America allowed some of their funding to be used for IT purposes for those who were isolated completely.
My role during Community Call was to pull together all the key players in the community into a community response forum and then coordinate and manage the forum going forward. I think the council and the partnership were at the fulcrum of the whole operation together with the South Dublin Volunteer Centre. We pulled together all the bits and pieces that needed to be done in order to meet the needs that were emerging from the community during the pandemic. There were so many individual remarkable stories during this time that it was impossible to pick out one looking back, but the overall theme of resilience and people stepping up to help others in their community was the theme and the story for me.
My role during the community call was dealing with the incoming calls. We dealt with nearly 2,000 incoming calls. Some queries we could deal with straight away if they were looking for prescriptions or food. Other queries we had to do a bit of research and contact the caller back.
Our chairman is Cormac Shaw, and through his professional relationship with Larry O'Neill, he opened up conversation and dialogue during the course of March into how Serve the City could assist primarily the partnerships and the county councils in the relationship as well, to help marginalised and vulnerable people with Community Call. So our organisation had paused traditional operations, and we were ready and willing and able to recruit volunteers to help with Community Call. And that was our primary relationship with South Dublin County Council and South Dublin County Partnership. Truthfully, the most sobering experience was a Sunday, receiving a text from a volunteer who'd been diagnosed with COVID. And whilst I had obviously followed the news and been incredibly drawn into the cognitive reality of COVID-19, when that WhatsApp hit my phone, my whole world just stopped. I didn't even know what to do. And there was this incredibly brave person that had sacrificed so much, happened to be in the wrong place at the wrong time, diagnosed, fully recovered, thank goodness. But that really was a moment that I think defined not only 2020, but my role as a volunteer manager throughout this community call.
From the early days we got involved with South Dublin Partnership, and what we would do is people that were in need that have been referred from some of the charities around, be it St Vincent's de Paul or through Heads Up or different varying charities that would recommend to the council that they needed help. We would step in and we would contact the family, see what they needed as far as shopping was concerned and food, necessities. We'd go and do the shopping and we'd deliver to them. I would say a huge community spirit was built between the volunteers and the people that we served, and some of them on a weekly basis, some we just seen for one-off scenarios. I'd say the saddest story that I came across was one lady in Clondalkin who lost both her husband and her father within 10 days of each other. The woman basically couldn't function, she couldn't think for herself, she could no longer run a house, and it was through the local community guard who came in contact with the helpline, who came to us. So we then for a few weeks looked after her food needs and her her family's food needs for a few weeks. And to get the thanks that came back from that just put your own life in a perspective to see what was happening out there.
During the lockdown, my role was to drive the van as a delivery driver. We used our care and repair van to deliver bulk food to the community centres that were set up as food hubs for people who were disadvantaged in the area. I also did delivery of parcels to hospitals for families in the community. There was one story in particular. There was a lady that I was doing deliveries to hospital to her husband who was in with underlying issues. I used to meet her on a regular basis once a week. I'd talk to her across the garden gate and you'd build a bit of a rapport with her. But her husband, he actually contracted COVID while he was in hospital, and he managed to beat it and got better from that. But all during the time, I'd always ask how he was and how things were going. But after we had kind of got back to some kind of normality, she gave me a call one day and she informed me that unfortunately he had died, he'd passed away, which I thought was very sad.
My role was to deliver prescription medication to vulnerable people. For example, there was a woman that needed medication for her husband and herself. She rang the community helpline, who got in contact with me to go and deliver the medication. I went to the local pharmacy, picked up the medication and delivered it to the door.
Lockdown was very, very tough. I live alone, so it was very lonely. I spoke with a gentleman called John, and then he asked, was there anything in particular that I needed help with? And I was okay for shopping, prescriptions, that type of thing. But I did tell him that I would probably have to ask somebody to go shopping for an electrical item for me. My microwave was on its last magnetron. I knew it was about to go, and as I have a significant disability, I find it difficult to use regular ovens and hobs and that type of thing. So my microwave oven grill combo is my entire way of cooking.
My role, I was managing the health and wellbeing team, and we were supporting people on the community call with advice and support. Mental health had been a massive issue for everyone, so we're supporting individuals that had come through the call as well as staff. Also, the team then had put together 110 care packs for the elderly that were living in residential units over the course of a couple of months. One of the biggest stories, I think, that will stick with me for a long time is we had a lady who was around 75, and all she wanted to do was go to Mass. And she had heard that the priest was now giving Mass virtually, so all she wanted was an iPad or a tablet or something. But she'd got in contact with Joe Duffy, who contacted us, and we went on the radio and told the story, and so many people had rang in and said, look, how can they help? With the help came the issue of transport, because we had tablets from Cork that we had to try and get up, and we had train drivers ringing in and bus drivers ringing in saying, how can I help? So we had a long link of people that had all come together just to get this lady to Mass and to see our grandkids as well. So that was a lovely story.
Hindsight is wonderful. I probably knew that going into it, but I think delegation, and I could have delegated an awful lot more earlier. I think the other thing is to trust your first instinct is normally correct anyway, but also trust the instincts of your senior management team, and you get work done.
I think I learned from the experience that we didn't place enough trust in all the organisations to do what they did best at a local level before we had to actually call on them, and that there's so much resilience out there that we shouldn't be afraid to engage with and tap into that on an ongoing basis.
From the experience, I learned that as a team and as an organisation we could work together, changing roles and working on our own initiative in a crisis situation.
What I learned from the experience is that there's a lot of people out there that are on their own and don't have any family, friends, even neighbours to help them out, and that they were isolated. And by calling the community helpline, it helped them out a lot, because they were very appreciative of being able to talk to somebody, because they hadn't spoken to somebody in so long.
I think as a community, everybody came together and did what they could. And I think just community and the spirit that went with it was just, it stands out in my mind as nothing was ever too big, If you rang somebody, it didn't matter what hour of the day or night it was, they would drop other things. They've rearranged their jobs, they've done all sorts of things to fulfill the needs of others. So I think community is a major plus for what happened.
I learned a lot about my team. I learned a lot about my family, me as a mother as well at home, teaching as well as working, as well as being in close quarters so much with my husband. I learned a lot about resilience, but I learned a lot about community and about when things are hard and how we kind of come together and help each other. So it's lovely.
You know, somebody who I never met, who I'd probably never spoken to, was prepared to go out and do some shopping for me, go shopping, something I hate doing, by the way, and pick up this microwave that just enhanced my life so much. Being that little bit larger, it enabled me to do more batch cooking, which was so much easier in the long run. And just that people were so community minded, prepared to go that extra mile to help somebody within the community who was struggling. That I am very, very appreciative of, and I can never, ever thank Community Call enough.
The world suffered while I learnt and had the most incredible experience of my career. Had no idea what I was getting myself into in March, early April, and would not change it for anything. I learnt about the Irish. New to the country, I learnt about the benevolence, the kindness, the spirit, the determination, the fact that nothing was ever a problem. I'd get hold of a volunteer and it would always be, no bother, and it would all be sorted out. I learnt that volunteering is quite possibly the most noble vocation in the world. I learnt that with hope you can do absolutely anything. And I also learnt that a mobile phone is only powerful when you look at who's on the other end of it. So Community Call for me was a time that brought me to my knees in the morning and put me straight to bed exhausted in the evenings. I loved it in hindsight, didn't understand it in the middle. But my word, what a remarkable, life-changing experience.
The one word I'd use to sum up the experience would be unbelievable.
Proud. Community.
Resilience.
Rewarding.
Exhilarating.